Well, welcome back. If you have spine or body pain that just won't go away, our next guest may be able to change that.
Dr. Neal Pollack is a board-certified neurologist and pain specialist, and he's here to tell us all about prolotherapy. It's super interesting. I'm really excited to have you back here on the show. Good to see you.
Thank you.
Yeah, let's talk about this because I think in general, a lot of people don't know what prolotherapy is,
Right.
but so many people live with really bad back, spine pain every single day.
Yes, yes. Prolotherapy is a regenerative therapy. You've heard of some of the others, stem cells,
Right.
PRP, it's a blood transfusion. Prolotherapy is probably the most efficient, safest, and most cost-effective way of taking a regenerative therapy.
How does it work?
It works by creating a normal inflammatory response in the body. For instance, the normal response of healing is to first produce some inflammation. Let's say I cut myself.
Right.
It gets red. There's a enlargement of cellular response. There's a scar that forms. It heals. It strengthens. Well, there's a lot of ligament instability, tendon weakness, which then forms into arthritis. This produces that local inflammation in these areas with a natural solution that then promotes this. A lot of these tissues don't get the same blood supply that regular tissues get, and they don't heal.
Because that was my main question is, you know, if we have inflammation in our body, especially if you have pain, and we try and get that inflammation to go away, that's what we often, you know, think of doing to relieve pain, but it sounds like there's a part of inflammation that's truly beneficial to our body.
Exactly. It's counterproductive a lot of times. There's a paradigm of anti-inflammatories, rest, and a lot of times that's overdone. And these tissues do not heal, and that's where these regenerative therapies come in. And prolotherapy is, like I said, the most efficient, cost-effective way to start this process.
What do your patients say after the therapy? Usually, and also, how long does it take? And then what are their results?
A lot of times it takes a number of treatments, spaced out at 3 to 4 week intervals usually. And typically, my experience has been, I've had a lot of experience with these, that you get a series of 3, and almost everybody, if you pick your patients properly, respond to this.
And this is something, what surprised me is how prolific it is here in Wisconsin at the University of Wisconsin-Madison. This is something that's very extensively used, taught, researched here.
Yes, it is.
And so when people go to use this, as Katrina kind of mentioned, they have how many treatments usually?
It's usually 3, sometimes less, sometimes more if there's a chronic situation.
Is it painful? You know, when I think of other treatments like this, I think of stem cell, and I don't know if that's painful or not. I just know that it's more expensive than prolotherapy.
Oh, a lot more. And stem cells they can get from different sources, and that determines the pain and the response to.
Correct.
Let's get back to prolotherapy. You asked if it's painful. There are a number of different injections, very tiny needle, and usually I use a spray solution that frees it up, and it's very tolerable. People walk in, they walk out. They don't need an anesthetic.
Is it the same, like a lot of people have had cortisol, you know, when they've got pain and it's that same kind of freeze, cortisone.
Yeah.
It's that same kind of freeze spray.
It is.
So it numbs it.
Sure, it's a completely different reaction. Cortisone is actually a potent anti-inflammatory medicine, and used regularly, it can be dangerous. It can weaken tissues.
Oh, yeah, they tell you not to do it too often. I mean, that's really what it comes down to.
Yes.
What are your best patients? Where have you seen the best results? What kind of pain are they suffering from?
Various areas. It's not that one responds better than another. I treat people with pain in the spine, various joints. You can go down the line: shoulder, elbow, wrist, hips, knees, feet, ankles, all areas.
So what this truly is doing then is building and repairing those damaged tissues.
Definitely.
It's not just putting something in your body to replace it, it's repairing it.
It does.
That's incredible.
and not masking it. I think because what
Yeah.
you've been talking about is when you are worried about inflammation and you take ibuprofen or Advil or cortisone shots, you
Yes.
know, you're really masking the pain.
You certainly are. You get a quick response, but you don't heal anything.
Yeah. So this is truly healing
Yes.
and repairing. So what do people need to do? How do they find out if somebody says they're sitting at home, they're saying, I've been off work, I've been living with pain, whatever it may be in my back, in my shoulder, in my knees, in my body, my hips. What do they do? Do they come in and see if they're a good candidate?
Yes, you have to be evaluated.
Okay.
And I pick my patients very carefully because I want them to get good responses. I don't just use it in everybody.
Yeah.
And I've had a lot of experience with this. My results are very good.
Love that. I think
Great.
that is going to speak volumes to a lot of people who live with pain and the fact that you don't have to. You can repair a lot of it. So here's what you can do. You can meet with Dr. Neal Pollack. He is, again, a board-certified neurologist and musculoskeletal pain specialist. Call him at 414-453-7780 or MilwaukeePainClinic.com is the website for more. Thanks so much for sharing that, doctor.
You're welcome.
Appreciate it.